Hi, so this is a video about a muscle called the supraspinatus that lives in the top of the shoulder blade. So I'm going to show you an effective way to treat that muscle, the trigger points. But first, this is just to give you an idea of location so that you can find it. So this is your scapula here, your shoulder blade. And then your shoulder blade has this line that comes up here, this bone, kind of like a ridge that goes across the top of it. And then in this little pocket here, so it's called supraspinatus because this is called the spine of the scapula, and supra means above, so it's above the spine. So in this little pocket here is a deep muscle called supraspinatus, and this muscle is really often involved in shoulder pain or problems with the arm. So as you can see, it's not a very big muscle and it is quite deep. And what happens is you can't really see it here, but this, they've got the spine of the scapula here, this bone that comes up here to form part of the shoulder complex. So the muscle's tendon actually runs underneath this and comes out here and attaches onto the head of the humerus, so the arm, effectively, the top of the arm. So where we're going to be treating in a second is this area here and out towards the arm. And I mean, it doesn't, when we're doing the treatment, it doesn't matter too much if you're on a different muscle as well. As long as we actually cover this one, then that's the most important thing.
Okay, so what we're going to do to treat this muscle is we're going to use a ball. So this is a small spiky ball, which is great. Or if you've got something like a squash ball, that would be good. That sort of size would also work really well. A tennis ball is probably a bit big, so this kind of size ball. All we're going to be doing is putting the ball up against the wall, so between our shoulder and the wall. And if you remember where this muscle is, it sits in the top. So you might be able to feel like the bony ridge of the scapula there, and then a bit of a dip in. If you can't, that's fine. Just aim to be in this whole area here. Okay, so I'm going to put it against the wall, we're going to lean into it and then just sink in. And then we're just going to slowly start to move around. What we're really looking for here are sore and tender spots, which are trigger points in the muscle. So you need to sink in quite deep. Don't let it be really painful, and definitely I'd advise having clothing on between you and the ball when you do this. So if you find a spot that's tender, then what we're going to do is wait and hold there for around 15 to 20 seconds. So just apply a bit of pressure between you and the wall. And then you'll have a bit of a move around again, maybe look for another spot, or come back to that same spot if you don't find anywhere else that feels tender. So that's essentially it with the ball. We're going to look for the tender spots. We're going to treat them at least twice. 3 times is great, with compression against the wall for about 20 seconds. Okay, then the next thing we're going to do is actually treat, remember I showed you on the video that the tendon for the muscle comes down and attaches. So it attaches right at the head of the humerus here. And if you actually palpate that, you might find that there's an ouchy bit right at the top there. So what we're going to do for that is get the ball against the wall again and just at the top of the arm. So you won't be able to see this very well, but you get the idea. You get the ball, you find that spot at the top of the arm there, and then we're just going to compress that against the wall and move around a little bit until we find a spot that might be sore. Hold again for 20 seconds. Then lastly, we're going to stretch the muscle. So the main action of this muscle is to do abduction, which is this. So we're going to do the opposite and bring the arm across the body. So it's quite a simple stretch, just bringing the arm across the body and then applying a bit of pressure. with this hand. And it's just important to keep your torso straight here, so we're not sort of twisting round. So where the torso is really facing forward, and then the arm is the only part that's actually doing any movement to get into the stretch. And then we're going to hold the stretch for around 20 seconds. 30 is ideal. Okay, so that's the treatment for the supraspinatus muscle.